Okay, well, good afternoon, everyone.
Hang on.
And thank you for joining us. Before we get started here, we'll do a couple of housekeeping things and some introductions. And first, want to acknowledge my colleague, Dr. Kate Smith, from the Delaware Academy of Medicine, Delaware Public Health Association. You should be able to see everyone, so Kate, wave there if you'd like. And Kate, just so you know, do we have folks coming in from the waiting room now? Are everyone live? Excellent. Okay,
Yes.
good. Very good. And so welcome, everyone. We're going to repeat some of this as we go on through the first few minutes, just so as folks trickle in, you can catch up. And we'll get started with the panelists' presentations in just a minute here. On behalf of the panel here, I'd like to welcome you all. My name is Omar Khan. I am with the Delaware Health Sciences Alliance, which is the academic alliance between the major health systems and academic institutions in the Delaware Valley. We are very pleased to welcome you. We are delighted that you took the time out to be with us this afternoon. We're going to be discussing medical education, largely the DIMER program, and hope to answer your questions. And after the event, we will send you a survey to hear more about who you are and what you'd like to follow up on. And so the purpose of today really is to give you a broad overview of the DIMER program and of medical education as envisioned by all your colleagues here and at the State of Delaware. So we call this our medical profession outreach event. We'll be on here for about an hour or so and hope to answer your questions. So just to give you a bit of a background about the Delaware Health Sciences Alliance, as I mentioned, we are a partnership between major academic institutions in the Delaware Valley, and we're proud to include many organizations in your neighborhoods as well, whether you're dialing in from Kent County, Sussex County, or Newcastle County. You will recognize many of the colleagues here on screen today and many of the institutions here as well. We have our website, which is www.dhsa.org, and we're also on Twitter and Facebook and Instagram. And later on, toward the end, we'll give you information on how to remain in touch and how we can keep sending you information about DIMER and all of our partners. So our panel of experts today, I really want to thank all of them for taking the time to be here with us. And in turn, this is the approximate order in which they will be speaking. What we're going to try to cover today is, as I mentioned, DIMER, the Delaware Institute of Medical Education and Research, now in its 50th year, which is amazing and remarkable. We're going to talk about recommendations for undergraduate students, college undergrads. We're going to be talking about what you can do right now, if you're in high school, to prepare for a career in medical education and in medicine. We'll talk about the University of Delaware Med Scholars Program, which is a terrific entry pathway to medical school. And we'll talk about how Delaware has set up opportunities for you to get into one of what we consider the Delaware medical schools, which are the two medical schools we partner with in Philadelphia, Thomas Jefferson University and the Philadelphia College of Osteopathic Medicine, which partner with many of the institutions in your hometown, such as Christiana Care and Bay Health and St. Francis and Nemours and the Veterans Administration Hospital, to make sure you have opportunities to train, to educate in Delaware, and to come back to serve Delawareans as well. And then we'll open it up for Q&A towards the middle and end of the presentation. We will keep a close eye on the chat button here, and anyone who would like to ask a question, you don't have to wait for us to open up the lines. You simply type in your question in the chat, and one of us will read that out during the pause in the presentation. So I hope you have a good time here. And our presentation panel is in front of you here. Sherman Townsend, who is the board chair of DIMER, Dr. David Barlow from the University of Delaware, who is also a DIMER board member and who runs the Delaware Med Scholars Program, Dr. Bob Monteleone, who is from St. Francis Hospital, and he's also a DIMER board member and is program director of the Family Medicine Residency at St. Francis Hospital. So what we'll do is we'll start off with talking a little bit about DIMER. And DIMER, as I mentioned, here's some abbreviations. The Delaware Institute for Medical Education and Research, which is basically the program, which Sherman will describe in just a minute. we'll talk about the SLRP, the SLRP, the Student Loan Repayment Program, which is a terrific way for you to get some of your loans repaid when you come back to serve Delaware. And HPSAs are health profession shortage areas. These are areas of particular need in states across the country, including in Delaware, where the federal government and the state government is very interested in having you provide services, such as primary care services like family medicine, and settle there and serve those communities and actually get some financial incentives to be able to do that. And we'll talk about the post-bac program, which Dr. David Barlow will cover in his part of the presentation. So with the DIMER, this is our DIMER logo, and I'm going to turn it over to Mr. Sherman Townsend, who's been DIMER board chair for quite a while, and so he has a great deal of experience in DIMER. So Sherman, over to you.
Thank you, Omar, and welcome everyone. I hope that today proves to you some benefit, and just know that all of us that you're talking to today are here to help each and every one of you. As Omar said, the Delaware Institute of Medical Education and Research, we call it DIMER, was founded in 1969 from the foresight of several physicians that had attended various medical schools, as Delaware does not have its own medical school, as you know. But DIMER was set up by the legislature, and it's funded by the legislature. The purpose is to provide slots for Delawareans to attend medical school. And as Omar said, this is our 50th year in existence. Our first class began in 1970. Since that time, we've educated over 1,200 Delawareans. So there's been a lot of activity. There are now two medical schools. We started with Jefferson in 1970. And then 20 years ago, the Philadelphia College of Osteopathic Medicine joined DIMER. So we basically have 30 seats reserved in any given year for students from Delaware. There are 20 seats at Jefferson and 10 at, I say Jefferson, it's now called Sidney Kimmel, old habit of calling it Jefferson. And PCOM, we have 10 slots there. First of all, anyone that is a resident of Delaware will meet the criteria to qualify as a resident to attend one of those schools. The key there is really having residence in Delaware. You may attend, however, any university, any college throughout the country, and still attend those institutions that are part of our medical program. So you do not have to apply directly to DIMER. You apply to those institutions. Once you apply using your Delaware address, they will identify you as a Delaware candidate, and you will then be considered a Delaware candidate. Without the DIMER program, on average, each of those two institutions receive over 10,000 applicants a year for roughly 280 slots in each class for the first year medical students. So with DIMER, however, when your application goes in from Delaware, it goes into a separate stack. And in any given year from Delaware, we have anywhere from 85 to 100 students from Delaware that apply to medical school. Most of them will apply to both of our institutions. So your probability increases significantly for admission because you're in a pile of 100 or less applicants versus being in a pile of 10,000 applicants. So there's a tremendous advantage in terms of admission for your attending as a DIMER student. And the other beauty of DIMER is that you have contact through our organization and through the Delaware Health Science Alliance. You have access to tremendous knowledge and people that are there to help you in your education process. So you have access to all of our education and healthcare leaders in the state, certainly all of the people that are a member of the DIMER board. We have, as I said, over 1,200 alumni physicians. Not all of them are practicing in Delaware, but there's certainly a large percentage of them that are. And your DIMER peers, Once you attend one of our two institutions, we have a dinner for all the first year students. And that's when you really realize that, oh my, I didn't realize you were from Delaware. So we sort of create a little bit of a fraternity slash sorority kind of a situation where you sort of, get to know each other and help each other through the process. So, and there are also mentoring opportunities available as a DIMER student to many of our physicians back in Delaware. So through our partnership with the Delaware Health Science Alliance, we provide also many unique opportunities. We have engagement opportunities to participate in various event panels. We have student research work groups, publication opportunities, and a workforce development and recruitment. We have a special Delaware Day at Christiana Care and welcoming all of our Delaware students. Next slide, please. I will call special attention to our 50th anniversary report. A lot of people put a lot of work into this, and it is a great report. There's a reference to that, as you can see. You can access that report. It will give you a huge amount of information about DIMER, our history, our program, and also in the back of that is a directory of all students that have ever attended either of those institutions as a DIMER student. So it's a great program, and the key is providing you an excellent opportunity to attend one of our two medical schools that represent our partnerships with two institutions in Philadelphia. So are there any questions that anyone might have? It was a quick overview, but if you will go to that site with the annual report, I'm going to say it will probably answer 90% of your questions that you might have. Does anyone have any questions?
Sherman, I just wanted to, first of all, thank you so much for not only your leadership of DIMER for all these years, but for being the guiding force behind all the work we're doing now to make sure Delawareans know about this amazing program that the state has in place for them. And you mentioned the annual report, which is this right here. And for folks who have, whether you have a paper copy or whether you have the electronic copy that's available for free right there online, you'll see that there's something called the DIMER Medical Students Profiles, which is right in the middle of the report. And that's really exciting because that is the story and the journey of folks just like yourselves who went to school in Delaware, who may have gone to college and university here or elsewhere, and then made it to medical school, which is a competitive and somewhat arduous journey. But we'd like to think that it's worth it because you get to serve Delawareans. But these are their stories, and we hope you take some time to read through those. I also want to emphasize something Mr. Townsend said regarding where you go to undergraduate to your college or university. You can, through the DIMER program, you can go to college wherever you'd like after high school. We, of course, would love for you to stay at one of Delaware's fine institutions, Del State, University of Delaware, Wesley College, Golden Beacon, and so forth. We'd love for you to stay in Delaware. But for those of you who go out of state, as long as you remain a Delaware resident through dint of your previous residency or through your parents or what have you, when you apply to medical school, you should have your Delaware address intact. If you have Delaware residency at that point, that's what matters. Now, there are some advantages, I think, personally, of staying in Delaware and going to one of our programs here, as Dr. Barlow will speak about, but you can go to college wherever you want. Medical school, which is after college, which is the 4 years after college, that is where you go to one of our partner schools in Philadelphia, essentially going to one of Delaware's medical schools. I just want to clarify that. I think what we would do is let's go ahead and Kate, do you think it's worth unmuting the lines for a minute to see if we have any questions verbally and see how we do with that process?
Sure, we can do that. If anybody has a question, you can go ahead and unmute yourself and speak it out.
Of course, we always prefer the chat box, but if tech doesn't permit you to do that, go ahead and ask a question. Otherwise, what we'll do is we'll go to Dr. Barlow's presentation, and we'll continue from there. Okay, so I'm not hearing any questions come through the line. So Kate, let's go ahead. Thank you for that. So in brief, the recommendations that that we think you may want to follow is we hear this classically around the importance of science courses, around the importance of mentorship, and around student programs. And the University of Delaware, their program for pre-health, which are led by Dr. David Barlow, those have done a spectacular job in really pulling together all these resources for you at the University of Delaware. And they include programs that you can take as a student at the university as an undergraduate, as well as a post-baccalaureate student. So I want to introduce Dr. Barlow to give us some more details about that. So David, over to you.
Thank you, Omar. It's my pleasure to be able to talk with you today about some of the program activities that the Center for Health Professional Studies sponsors. Next slide, please. Our center, created in 2012 by a task force of university faculty, administrators, and so forth, was designed to enhance student opportunities for matriculation, surgery, optometry, and other healthcare fields, but with a primary focus upon students pursuing medicine and dentistry. This has been a very successful endeavor. Next slide, please. The nature of our center in doing so supports all colleges where pre-medical and other health professions may be pursued by students. It typically represents about 12 different majors and at least 5 different colleges. It's designed to enhance student opportunities to make them competitive applicants as they pursue their goal of admission into healthcare profession programs of study upon completion of their baccalaureate degree. Our center sponsors a number of different programs, and I'll just mention them by name here shortly. A medical scholars program, which is an early conditional acceptance program between 3 different institutions: Thomas Jefferson, Philadelphia College of Osteopathic Medicine, and with a growing number of students from the state of New Jersey, the Rowan School of Osteopathic Medicine in Stratford. It is a program where students designate their acceptance into the medical scholars program upon completion of their sophomore year. Other particular activities include programs of sponsorship for a post-bac certificate program, programs designed to enhance student opportunities for study abroad, a pre-health professions living learning community for freshman students exploring different healthcare options and programs. Next click, please. Next slide, please. Our medical scholars program is one that was established in 1993, and now in its 27th year has been highly successful in having students matriculate into one of our 3 affiliates. The number of medical scholars program students in just the last 12 years, over 482 individuals, not counting this year's class. DIMER students in the medical scholars program represents almost 2/3 of the students in the program, but keep in mind the medical scholars program serves all University of Delaware students, whether they come from the state of Delaware or other particular states around the country. We sponsor in this particular program required medical practica and internships. As of last year, we had a total of 384 completed by students in the program. Keep in mind, these are programs that are designed to make our students unique and to have a very thorough perspective of just what it takes to be a healthcare professional. Our medical school matriculation rate for students in this program and upon graduation year 1 has been 72% since 2008. That number is actually increasing this year. We're seeing a class which is matriculating into Jefferson and other schools at a rate of over 80%. In postgraduate year 2 and postgraduate year 3, after students have completed their baccalaureate, those who did not get in upon immediate graduation are now achieving a success rate of 95%, which is quite remarkable, we feel. The Health Professions Evaluation Committee is a committee that is designed to support students who are pursuing healthcare professions, but not as members of the Medical Scholars Program. These are students who perhaps are a little bit late in deciding the desire to pursue medicine, or perhaps as a first year, second year students did not feel that they had the requirements essential for meeting the competitive standards necessary to matriculate into medical school. This particular committee evaluates approximately 100 to 150 students every year who are pursuing medical school admission. They may be parts of the DIMER program, but for the most part, they tend to be students from other states. We have about a 40% matriculation rate over the last 12 years out of this particular program, although we feel that in postgraduate year 2, that number probably jumps up at least 15 or 20 percentage points. Our pre-health professions living learning community is a program designed for first-year students who are exploring the options of various healthcare professions. In the center of this particular slide, you can see Dr. Neil Jasani with hosting a group of our freshman students in the VEST Center of the Christiana Care Health Services, exploring different options, meeting with physician residents, meeting with medical school students, all at this particular time. And this is an opportunity for students who live in a common dormitory, share a common living learning room environment, and have an opportunity to interact with peer mentors over the span of their first year as undergraduate students at the University of Delaware. I might add that this particular group of students, since the formation of this program in 2015, we've had 100% retention, with the majority of the students pursuing successfully healthcare professions as they move forward towards graduation. Next. We have a pre-medical post-bac certificate program. This is a program for individuals who have baccalaureate degrees. Before you in this particular slide, there are 11 individuals who were recently feted at a reception at the Philadelphia College of Osteopathic Medicine. 6 of the individuals in this slide came out of our post-bac certificate program. These were older students who were career changers who decided after they graduated that they definitely wanted to pursue a healthcare profession. And we're very proud of those particular individuals. Since the formation of this program, 100% of the students successfully completing the post-bac have matriculated into medical school. Next slide. We sponsor medical internships both domestically and abroad. Probably domestically 25 to 35 students, except for this year because of the coronavirus limitations. These kinds of experiences help our students be exposed to the practice of medicine in a wide variety of different settings. The image before you is at Semmelweis University in Budapest, Hungary, where a group of about 25 students were mixed with medical school students and health profession program students at Budapest at Semmelweis University, one of the second oldest medical schools in all of Europe. The students that are depicted in that particular image were highly successful in moving on to admission into health profession programs of study. Next slide, please. So relative to the Center for Health Profession Studies, we try to maintain affiliations not only with medical institutions, medical school programs, certainly our state agencies, Delaware Health Science Alliance, DIMER, and so forth. We have an affiliation with an international medical school in the West Indies, St. George's University. These are programs that greatly enhance our student experiences as they move forward to pursuing healthcare professions. It helps to make them unique in a competitive applicant pool of over 50,000 some odd applicants applying for about 20,000 medical school positions each year. Next slide, please. For more information, I've only given you a very brief overview of the services that the Medical Scholars Program provides. But for more information, I would encourage you to take advantage of pursuing our website, which is listed here. We certainly provide opportunities to enhance student experiences in drafting their personal essays, filling out their AMCAS or COMAS applications, taking the MCAT exam, that dreaded marathon of an examination that they have to take in order to be competitive applicants. So I hope that if any of you have questions, certainly don't hesitate to address them at this time. Thank you.
Well, thank you so much, Dr. Barlow. That was a terrific overview, and it's just so incredibly impressive that the work of the center and of all your faculty and staff, what amazing success they have had in helping Delaware students achieve success in the health sciences, and for many, many years. So thank you so much for the presentation and for the service that you provide to Delawareans. We have a couple questions coming in here. While the first question comes in, I wanted to ask Dr. Barlow about what proportion are you seeing in terms of within the provider community, that is those who are interested in going to schools to receive a medical degree, that is an MD or a DO, and those who are more interested in a PA, physician assistant, or a nurse practitioner degree to practice medicine. Have you noticed trends in the last several years that reflect any changes?
Omar, I do see an increase in the number of students pursuing physician assistant programs. I serve as the university faculty advisor for that particular club on campus. And 4 or 5 years ago, we might have had 20, 25 students pursuing physician assistant programs. Last year we had over 200, and the number seems to be growing as the number of certified programs increase nationally to over 200 now. In the osteopathic and allopathic medical school directions, I think nationally it's about 75% allopathic MD programs and 25% pursuing osteopathic. But I can tell you that at the University of Delaware, it's probably closer to about a 60-40%. There's a growing interest in osteopathic medicine among any of our graduates pursuing medicine as a career. So I don't know if that addresses the questions, but I would assume that Chantel has a question about how competitive the post-bac program might be. And I would definitely say that it's one that if a student excels at a level of at least a 3.5 in the core science courses of the post-bac certificate program, that they, since 2015, we've had a 100% matriculation rate into medical school. Now, that's not to say that students with below that level might not have been successful as well, but the chance and the probability is less significant. So if you can maintain an AB average as a post-bac student, as a career changer, pursuing medicine as a focus of your future direction, I can almost say with a high degree of assurance that you will be successful.
Dr. Barlow, thank you for that question. And a couple of questions I've gotten both from the chat function and other mechanisms have been, is admission to the post-bac program itself, how competitive is that? So for example, you and I have talked about a couple of types of applicants who might apply to your post-bac program. One who took science courses in college and who may have found that for whatever reason they were not as successful and they would like to bolster those courses to apply to medical school. And the other one is, as you say, the career changers who may have been majors in a completely different field and who for whatever reason decide to pursue medicine and they're now applying to the post-bac program to get those credentials to begin with. Could you speak a little bit about how competitive those types of applicants might be to get into your program and how you view that kind of mix of applicants?
I'm happy to, Omar. There are 4 different types of post-bac programs. Grade enhancer for the student that was an undergraduate that did not have the kind of academics to make them competitive applicants in medical school. Career changers, students who change their focus and direction after completing their undergraduate programs of study, and perhaps after occupations and fields non-related to medicine. A third type would be for financially disadvantaged, underserved, represented populations, perhaps. And a fourth type would be a biomedical science master's degree, which is usually a 2-year program. Our post-bac program is a 12 to 18-month program, rolling admission. We require 2 letters of recommendation, an undergraduate transcript that demonstrates at least a minimum overall grade point average of 3.0, and a strong stated passion for the pursuit of healthcare profession. And students that have fallen into those particular categories, if they can meet those basic requirements, we've been happy to enroll them into our career changer program. We limit the program to 20 students, and that provides us the opportunity to strongly mentor those individuals in the program to ensure that they're getting the kind of direction and advisement and success necessary to be successful. I think the mentoring aspect is critical for these individuals who are returning after perhaps several years from their former undergraduate programs of study.
Thank you, Dr. Barlow. And for those types of applicants, it is a full-time program, is that correct?
It is a full-time program, although we do allow rolling admission. We require a deadline date of April 15th for students attempting to matriculate in the start of the fall semester, October 15th for students attempting to matriculate at the start of the spring semester. But we do accept students applying for the program who recognize that there may be some difficulty if they apply after the April deadline date for the fall semester in gaining seats into those particular classes. We can't guarantee as much of the opportunity to make sure that they get the bios, the chems, the physics, the organic chemistry courses essential for pursuing medicine. These are undergraduate courses, and so therefore they're taking these classes with undergraduate students and competing for the same seat. The nice thing about this is that for Delawareans, they're paying.
David, thank you so much. Your screen froze a little bit there, but I think we got most of that as well.
Okay.
So what we might do is we have a couple more questions coming in. Let's move on to Dr. Monteleone, and we'll keep those questions in the chat box, and we'll absolutely come back to those. Dr. Bob Monteleone is a program director of the family medicine residency at St. Francis Family Medicine in Wilmington, Delaware. And Bob, again, thank you very much for taking time out of your busy practice to be with us. So over to you.
Sure, thank you. So just hearing some of those statistics from Dr. Barlow, when people are deciding about their career and their path in medicine, Delaware definitely has a path that I think is honestly easier than most states in order to get into medical school through this DIMER program. And so I'll talk a little bit about that in some of my other slides. So the typical journey for, from student to physician, first of all, of course, you have to select your undergraduate institution. Getting involved in a program like DIMER and what we have to offer is really helpful to guide people to get into their medical schools after that. So there's a medical school application acceptance process. And then during medical school, when you're at one of the DIMER schools, then you'll often spend or have the opportunity to spend clinical rotations, either elective rotations at really any of our hospitals in the state, or there's a branch campus for the medical students in their 3rd and 4th years at Christiana Hospital. And then after that, there's the residency interviews, and we have a variety of residency programs in the state, and those numbers are increasing. This next year, Bay Health is adding a residency programs. So the opportunities within our state for where to train is also expanding. And the match day is an exciting time. We just went through that in our program, and we have 6 new residents starting next week. Which, what a great start to start during a pandemic. What other better time is there? So a few challenges with that, but we're excited to have them come aboard. And residency training, depending on your field, is 3 to 5 years in duration. Whether you add fellowships on the end of that can make it longer if you choose to, and then you get to become an attending physician. So a little bit about myself. This is a little bit of my story. So I'm originally from Ohio, and then I trained in Connecticut in family medicine residency, went to med school in Ohio at University of Cincinnati, and then went to undergrad there as well, and then went off to Connecticut for residency training. And I started out in clinical medicine, and my interest was really in rural health. And also an interest in global health. So just a few of these photos, the one of me on the left as a child in Peru. So I went on a mission trip there, which is also a lot of fun with our global health teams. So you can really get involved in global health at the local level or with different trips. Like Omar said, I am a residency director, and this was an axe throwing competition, the top slide with all of our residents. I won't say who won, but it was not me. It was the woman who's our coordinator, who's perfect, who's holding the axe, who can track people down if they don't do what they're supposed to do. I have two lovely daughters who are pictured there, which reminds me of the importance of work-life balance as you journey through medicine, that you want to take time to enjoy the things that are most important to you. Like in the center slide in the bottom, I like cycling with my friends, and that's a bike the Brandywine event. And I've always had an interest in teaching all the way through. Even when I was a resident, I knew I wanted to be involved in education and medical education. And I think when you have a diverse interest and background, it makes those educational opportunities more interesting. Dr. Barlow has sent me students over many years now that have had, and I can tell you the quality of the students that come through DIMER are the really amazingly solid and consistent. So I do thank the program for sending me those great students to work with. You can go to the next slide. So now this was always the big question, like, what do I have to do to get into medical school? How can I make sure that I achieve that success? And when you look at those numbers that Dr. Barlow was talking about, 95% acceptance rates with a GPA of 3.5, that's unheard of in most places. I mean, those are incredibly high acceptance rates in the medical field. If you look at the overall applications as a 3.55, so that's just the number of applications. In allopathic schools, the average GPA is 3.69. So David, while you're on the line, 3.69, how many of your students with a 3.69 coming out of the DIMER Med Scholars Program would you say would get into med school?
Bob, it's quite interesting. The average medical scholars program student graduates with a 3.83. But we have students with that run the gamut from 3.5 overall, with 3.5 in the core science requirements. As long as students have at least a 3.5 in the science-based courses and a 3.5 overall, they tend to be very competitive. Now, if they have slightly lower GPAs, they have to do exceptionally well in the MCAT exam to offset that kind of profile. I don't know if that answers your question, but we know that students in the Health Professions Evaluation Committee that go through each year, the 100 to 150 students, their GPA tends to be closer to the 3.5 range. And therefore, perhaps the reason that about 40% get accepted upon graduation.
Okay, so it's really that post-bac program that had those high acceptance rates with those GPAs.
But yeah, and I think I attribute that to the fact that the post-bac students demonstrate a passion and a commitment for pursuing medicine that is really unique and special. And medical schools and missions officers recognize that. And I do have to mention, too, that our post-bac program is affiliated with medical school. And so PCOM is one of the popular choices among many of our students in the post-bac program. It just seems to be a great fit, and one that they like as a medical institution, and we like, our students really like as a consequence.
Yeah, so that's I think it's just points out you really have to work to keep your grades up and your GPA up to be competitive, because it is a competitive field, and the selection process is challenging. But when you look at it overall, if you take one semester at a time and just focus on it, that's how I went through each semester, just focusing on one at a time. Over time, you'll see that GPA, and as you go through, you often get better at it, and so you can get that GPA to rise as you become a better student. But that is the part that the students really have to do, is to keep those grades up, keep the GPA up, get involved in extracurricular activities. You're a well-rounded applicant, in leadership positions are important as well. It's interesting, they had a thing at the AFP about what makes the best resident in a residency program. And the answer actually came out. It wasn't about their board scores. It was Division I collegiate athletes made awesome residents. So it's about their teamwork and their ability to work well with others, and then their dedication, because you think about what that involves to become that level of an athlete. So people with that same determination and drive are the ones that really succeed well in medicine. So now the places where DIMER can help, now I was not a D1 athlete, so I still made it, so don't worry if you're not. So, but the factors where DIMER can really help, we have a lot of connections, and Delaware's a small state, and we know a lot of people, so you really can get connected into medical setting experiences, and also other volunteer organizations and activities. Many of us are involved in the communities. We're here at St. Francis, we're very closely involved with the Delaware Food Bank. There's other organizations that we have social workers here that always are looking for volunteers for programs. So there's definitely ways to get connected with the community and volunteer experiences through connections that you have with the DIMER experience. Getting evaluations from faculty members, especially in a small place like Delaware, when you're applying to PCOM and you're applying, many of the faculty know us. Many of the admissions people at the universities know who we are and value our letters. So I think it really helps get those letters and meaningful letters, not just, oh, they rotated within my office. This is, you get an opportunity to get to know the preceptor. I mean, I work with them for months, and sometimes we extend it over time when the students want to stay longer. We want to say, oh, I could just come once a week for a period of time longer as they're part of the program. And we work with them based on their schedules to really get them the experience and time that you need to really get to know them well in order to write a good evaluation and a reference letter. There's people in the community that can help with, in the DIMER community, that can help with how to write a personal statement. That's one thing that our program does for some of the people that rotate through, is how do I write a good personal statement? We're really focusing here more for medical students applying to residency programs, but it's a very similar process on how you get a good personal statement, which one makes you stand out. Because if you're in a pool where your GPA is sort of competitive, but there's a lot of people in there, you need some things that bring you up a little bit. If they catch something on the personal statement or just doing interviews, personal interviews, I know that Dr. Barlow works with students on that as well, on practicing interviews. We actually had some of the students come through here and be mock patients to see how it was to be interviewed on the other side of things. So it's just, there's ways to practice your interview skills in our programs. And I did mention also the community service activities. There's also other docs in the state that we can connect people with who are involved in clinical research trials through all of the hospital systems. There's somebody in each place doing some clinical research. So next slide. So this is what the heart and soul of what I do is family medicine residency, 3-year training program. What I want to highlight is, as far as the DIMER program, is we are very interested in getting medical students to come back to Delaware to be doctors. There's a shortage of doctors, specifically primary care doctors. Downstate, there's a shortage of almost every type of doctor. Specialty practices are short downstate, but primary care, family medicine, definitely a shortage area. So there's going to be 3 residency programs in family medicine in the state. Every residency program in family medicine is uniquely different. It's really a feel and a process of going through and finding out what fits best for your learning style and what environment you want to best learn in. There's some challenges this year with COVID that the students are talking about doing virtual interviews, and I'm fine with a virtual interview on selecting someone, but boy, is that tough for a student to pick a hospital and a residency program when they actually haven't been to that site. But it is interesting on the strength of each program. We cover maternity care, newborn, pediatric care. I personally still do deliveries and obstetrics. I'm on call tonight for that, so hopefully it'll be a little quieter than the weekend was. We do hospital medicine, outpatient care, mental health, just a broad scope that family medicine training involves. And the biggest thing we have in family medicine is the continuity of care as a focus. The care over the lifespan, continuity of care over many years, so patients have a place, a home that they can go to for their healthcare needs. So this was a little fun thing I did at the end of my 3 years as part of my journey. Is I decided to do a rural health fellowship, and this was my certificate at the end, which is kind of comical. I was the rodeo doctor for the year in East Texas. It was a lot of fun. I had to ride in the parade. Never rode a horse in my life. Had to get on one, but so the things you get to do in medicine, you just the experiences that you do. I never would have pictured that I would be doing a rural health fellowship and then ended up in an urban residency program. I mean, the gamut of things you can do in medicine is just so broad, and you just enjoy it along the way. I love the field. I wouldn't change it for the world. Even in the difficult times we're in, I would still do all of it again. There's all kinds of these fellowships you can do. From the traditional ones, this one was just a 1 year maternity care and rural health training, really to get, which tied well to the global health interests that I have, that you can go to a place without many resources and have a skill set to take care of people. So that's a little about my story. Please feel free to contact me if you have any questions. Always happy to help students out along their journey through medicine.
Great. Thank Dr. Monteleone, thank you so much for sharing your story and your journey and giving us some great information about the arc of what it takes to go from essentially a college student all the way to a practicing physician. And so I hope the folks who are participating in the call can see kind of how we're helping you draw that arc from the beginning through college, through medical school, onto residency, and eventually onto practice. Dr. Monteleone, we have a couple of questions that came in, which maybe you can help address as well. One question was about medical scribing. And as we know through the electronic medical records and so forth, medical scribing has increasingly become a way for learners to be able to participate in the process of medical education and learn about patient care to some degree at the same time. Do you see medical scribes at St. Francis? And if so, how do you see them as using that experience as being prepared for a future in medical school?
Yeah, they have medical scribes in our emergency room. We don't have them in the residency program because there's some discussion about it, but the feeling is that residents really need to be able to learn how to do it on their own, as far as the entire note and everything, because they may go out to a place that doesn't have scribes, just to get them into that workflow and efficiency. But I think medical scribes are highly valuable, and some of the clinical family medicine offices I know in the community definitely use them. The experience to be a scribe is also a great experience because you really just get very good at, well, you get good at the documentation, which is one of my least favorite parts. You know, I think we all struggle with that, but you get quite efficient with that. And then you also just see how a doctor thinks, because you're really writing down what their thought process is during a visit. So I think it's an interest, not a requirement to go through to be a scribe. But I know when I see somebody has a history of scribing as far as a residency application, I think very positively of that experience.
Yeah, thank you, Dr. Monteleone. Dr. Barlow, if somebody has a medical scribing experience, would you like to gain it? Will that count in the medical scholars program's clinical hours requirement?
Omar, absolutely. A lot of our graduate students in our post-bac program actually work outside their academic programs of study as medical scribes. And it does significantly enhance, as Dr. Monteleone has stated, I think the qualification of their applications. I also see a lot of students pursuing physician assistant programs working as scribes, some working as EMTs, in order to try and see if they can somehow gain more hours of patient contact experience or related contact experience with healthcare professionals. So scribing is definitely an excellent way, and it actually results in some salary. Although it tends to be very low, it tends to help to pay some of their bills as they move along. I recommend it very highly to our students, particularly to our graduate students who tend to have a little bit more time outside of class. They're not taking all kinds of minors and elective courses and so forth. They're only focusing on the core courses required for medical school. So they tend to have a little bit more flexibility in pursuing scribing as a student.
Thank you, Dr. Barlow. Dr. Monteleone, I was struck by your story around family medicine and how, I was trained the same as yourself in family medicine, and we both did obstetrics, and of course you continue to do obstetrics. I think a lot of folks don't even recognize that the so-called old image of a family physician as doing everything from cradle to grave, so to speak, delivering babies, taking care of newborns, being in the hospital, going to their offices. It's actually far from being a myth. This is in fact your daily reality, and this is how many family physicians are trained. And in fact, it is what many communities, I would venture to say most communities in this country, would benefit from, having effective, strong primary care that can in fact follow them through their life course. Given that situation, I wonder if you would have anything to add to that in terms of Delaware's needs. And one of the questions we got was, why does Delaware struggle to attract physicians? And I guess I would say, I'm not sure that Delaware struggles to attract physicians as much as perhaps having them go to the right places in Delaware, and that can sometimes be a challenge. But I wonder if, Dr. Monteleone, you could reflect on that a little bit in terms of the needs of Delaware and how family physicians are trained.
Yeah, I think it's interesting, especially in the obstetrics part, when you look at the traditional model has been largely people go to their OBGYNs for the training, for the prenatal visits. There's shifts now with the laborist models where some OBGYNs are just covering labor and delivery, and they're going to their outpatient OBGYNs for their prenatal care. And I think that's a role where we do have some trained family docs now who don't want the lifestyle that I love of being here at night, that they want to do the outpatient only visits. And we do have family docs doing that just in their office for prenatal care only. As far as the needs of the state, I think that primary care connection you have with patients is so valuable. Every week I have a patient that has questions after they even see their OB, and they'll just come back and ask me, even if I'm not seeing them for that, but I'm their primary doc. They'll just say, hey, they were gonna give me this medication during pregnancy. Is it okay? Is it okay if I use this with breastfeeding? Just all those questions. So to have that support from the patient, for the patient, from not only their OB provider, if it's a different provider, or if it's the family doc, I think it's a team. It really is. We're a team and I tell patients, I don't mind at all if you see another provider for your obstetrics care. I just want you to get care. Delaware has a high rate of low birth weight, and we need to address that. The whole COVID thing makes me scared more about, are people going to be doing more home deliveries? That's a concern because there's safety concerns with that. So people are afraid to come to hospitals, which I feel very safe in the hospital because we're actually doing things right in the hospitals. The rest of the world, I go out there and they're not wearing their masks right. They're wearing them below their mouths. I feel perfectly safe in my hospital. So I hope patients feel the same way, that they can get that security and safety. A little about family medicine obstetrics. There actually was a study on family doctors that do deliveries versus those that don't. Family doctors that do practice obstetrics actually have higher job satisfaction scores than those who did not. So it is extra work, but it is a very rewarding part of our practice that I really enjoy. And I think there's a program here at St. Francis called Tiny Steps. Really, it's for the underserved prenatal population, where we're really taking care of a lot of completely either uninsured or Medicaid patients, high risk, social, not high risk OB, but socially high risk patients who have a lot of needs, and just trying to facilitate and break down barriers to get them into care, including evening clinics, including we'll see you before you even applied for your Medicaid program, and support you through the visits and testing and get everything done to make sure you have a healthy outcome. I think that's a role that any family doctor in the community, in the state, can support. And I think that if we encourage that training and participation as a team-based effort in care, we can really impact those issues that we have with low birth weight in our state.
Thank you, Dr. Monteleone. I think those are all really important thoughts as we reflect on how do we attract physicians back. And the question that was asked around why we've struggled to attract physicians, I think is a complex one. I think, Bob, you touched on several of those. I know Sherman has an insight on that as well, and we'll bring him into this also to help address this question. I guess I'll say, I think the question was asked by Chantel Mason. You know, I think the question is really of where we want what kind of medical care to be provided. We would love for all Delawareans to have access to effective primary care, effective specialty care, effective surgical care at all times. That is our vision. That is what the DIMER board and all our colleagues are attempting to do. I think a lot of factors happen simultaneously. We had private practices having some trouble with recruiting physicians coming to town. We had the cost of medical care and access, going up. And we had a financial model, frankly, that did not support a lot of small private practices and family physicians to be able to remain in practice. So they went and, joined health systems, which typically were located in larger communities and cities. I think that the wave of that is changing because we have models now that support practices to be in those smaller communities. Many large health systems are setting up practices which are serving those communities as well, and therefore helping to recruit physicians back to the state. So I would say if somebody's interested in coming back to Delaware, we will find them a place to be. We will find them fulfilling employment. We'll find them communities to serve, and we'll try to make their lives as rich and fulfilling as possible as active medical members of the community. We are trying to recruit more physicians through efforts like Delaware Day, where all the community hospitals, all the hospitals in Delaware get together one day of the year and put job offers out there to providers from all stripes, nurse practitioners, PAs, MDs, DOs, nurses, and we want them to come back to serve Delaware. So we're really looking like a lot more unified effort, honestly, going forward. Your point is well taken. And I think as we make our communities more attractive for folks to settle back down, that's another piece of it where we have to partner with communities. Sometimes folks want to come back and they want, a Pilates place, a gym that does that, or they want their local coffee shop. They want a certain kind of place to live or to bike and to, have the lifestyle they want. And that's a fair assumption, fair request. So I think Delaware has all things for all people in many ways. We just got to find the right fit sometimes. So we're trying very hard to do that. Sherman, would you like to add something to that in terms of what we're doing to attract Delaware physicians? Keeping in mind the next slide is actually on the student loan repayment program, which we can go to as well. So Sherman, over to you.
Yeah, thank you, Omar. Yeah, I mean, right now we're working really hard trying to get adequate funding. The average medical student today, graduating from medical school, can have close to $300,000 in student loan debt. And what we're really trying to do here, particularly to attract students to serve in the underserved areas, and of course the buzzword is primary care. We need more primary care, and there's a lot of pieces of that, including pediatric and mental health and a lot of different things when we look at that whole need in Delaware. But we're working hard on getting funding to help students pay off their loans. And the program we're looking at I guess we talk about this a little bit later, what our vision is that we can provide a student maybe up to $50,000 a year toward their debt if they sign a 4 or 5 year contract to come back and practice in Delaware. They'll get, roughly that $50,000 per year for that period of time. And the other factor that people look at in deciding where they're going to settle, what we're seeing in my 30 years of dealing with this, we have a lot more medical people that are marrying other medical people. So we've certainly found situations where we really jump in, and I call it a 2-for-1. So if we have a real lead on a physician, particularly if it's a DIMER student who's wanting to come back to Delaware, but they're also looking for a job for their spouse, we will really bend over backwards to find a fit for the spouse as well. So again, it's the beauty of Delaware. We're a small enough state that one of us on our board will know somebody in the system that will assist in job placement, not only in the medical field, but in so many other fields that the spouses might be involved in. So, but there's a lot happening. Southeastern Delaware is one of the fastest growing retirement communities in the country. A lot of people are moving down to the beach area. And it's a pretty nice life down there in terms of a lot of recreation for the family. And we're working hard in the secondary schools to improve those situations. So there's a lot going on in the state in the education side, but trying to do everything we can to make our communities much more attractive to a full spectrum of people that might want to serve in the medical field.
Thank you so much, Sherman. So as Mr. Townsend alluded, there's things that you can do right now, and Dr. Monteleone mentioned as well, the various opportunities that are out there. On the next page, one of the key ways to keep in touch with what's happening around the state, and certainly in healthcare, we have the Delaware Journal of Public Health, which you can access for free at www.djph.org. And we like this because this is homegrown. It's in Delaware. It's the most widely read health sciences journal here. It's put out by our partners at the Delaware Academy of Medicine and Delaware Public Health Association. I'm pleased to be the editor-in-chief, and in fact, everybody on this panel has written for the journal at some point. And I want to highlight that, especially in the COVID-19 pandemic, we're going to need a different skill set from everyone going forward. We found that we were honestly kind of underprepared in many ways when this hit. And this comes from folks who actually do preparedness for a living, such as Dr. Monteleone and myself. Bob is all on the front lines of preparedness in many ways, and he and I are both members of the Medical Reserve Corps. And honestly, we were not well prepared in many ways. And a lot of this comes from knowledge from other fields: engineering, public health, preparedness, and emergency planning. And so I would encourage students to be as well-rounded as possible. The medicine of tomorrow is going to sometimes look very different from the medicine of today. So it might mean learning about global health, might mean learning about international development, health services, health policy. So be open-minded, and we've tried to keep our journal as broad as possible. These are just a few of our recent issues. The most recent one is on health sciences education, which I would highly encourage you to read, because everyone here has written an article for that which talks about the medical education opportunities in Delaware, in your state. So I would encourage you to read that online. An issue last year was on global health, and an issue towards the end of last year was on health policy, what we're doing in Delaware to improve health policy and payment for care. So please check this out. They're available in paper form, available in online form. As students, you may wish to write for the journal as well and get some experience in that regard. And you can contact Mr. Tim Gibbs, who's right on there, publisher, tgibbs@delamed.org. Dr. Kate Smith, who is on the call, is the copy editor and very involved in journal production here as well. And she'll be happy to talk with you about this as well. I want to just pause there. First of all, thank you. We'll open it up for questions as well in just a minute here as well. But I want to thank you, first of all, for joining us this evening. I want to thank the panelists. I want to thank all the organizers, Pam Gardner, Kate Smith, everyone who helped put this together behind the scenes. We hope you like the presentation. There is a QR code on your screen, which you can scan into your phone, and you can access the survey that will come up as a result. So we'll leave that up there during the Q&A. So you can just scan that in, and you can tell us what you think and what you might like to hear about next time. We will try to do these webinars at least a couple more times this year. And again, we want to make sure it's informative for you all to hear about. So let's open it up for questions here. You can type into the box. We have one question waiting for Dr. Barlow, so we'll get to that first. Dr. Barlow, if an applicant for the pre-medical post-bac program isn't admitted to the program immediately, so presumably the person has gone through undergraduate, doesn't get into the post-bac program, what might you suggest for them? For example, should they attempt individual classes at the University of Delaware? Or what might be your suggestion for them at that point?
If a student applying for our postbac program does not have an undergraduate transcript that reflects an overall grade point average of a 3.0, we recommend to those particular individuals if they somehow should demonstrate as continuing rigorous core science course requirements. I can think of an individual who graduated from the University of Delaware in 2003 as an econ major, wanted to be in our post-bac program. I looked at his transcript and he had a 2.3 grade point average. And I told the individual, I said, you know, because of our requirements for our program, you haven't been able to demonstrate the ability to handle this minimum overall grade point average. But I said, if you can take, and I gave him a list of 1 year of biology courses, 1 year of chemistry courses, and demonstrate academic excellence in those courses, we will use that as the basis for you to prove that you can handle the academic rigor. The student involved came back after 2 semesters with a 3.8 grade point average in the core courses that we asked him to take, and we immediately accepted him into our program. He finished our program. He just graduated from a medical school in Philadelphia, and I'm very happy to report that he's just taking on his residency in the emergency medical department at Christiana Care. So it is doable, but it may be a little bit different pathway for those individuals who are passionate about pursuing medicine, but might not have the undergraduate record necessary to be immediately accepted into the program.
Thank you, Dr. Barlow. I think it's really important to reflect also on what Sherman said, which is this DIMER board is composed of folks, some of whom you see here, who are all out there, and we want to make sure that we want to answer all your questions and be out there in the community to meet you where you are. And this is an amazing resource. That is the benefit of having a DIMER, a Delaware program like this, and not be, frankly, in a larger state like Pennsylvania or New Jersey or Maryland or New York or wherever else you could be in the surrounding area. You know all these folks. They are not 500,000 miles away from you because there's no 1,000 miles away in Delaware. So, you know, you can access them, you can talk to them, you can meet with them. And our job collectively is to help you find your journey, whatever that might be. And whatever your passion is, presumably it's to help people in some way. Sometimes we can open your mind to other career paths that you may not have thought about. All of us are career educators, and we've worked a lot in health sciences. We may have insight into certain careers such as public health and research and other types of things that you could get involved in your pathway, whatever you ultimately decide to do. So keep that in mind. Access us for whatever you would like to know about, and we'll try to get you the answers. If not on the board itself, we'll try to get you linked to other folks out there. So we're not trying to direct you to any one career path. We want you to become the best qualified, most well-rounded individuals to come back to serve Delaware. Whatever that looks like is up to you. We will try to help you get there. So Kate, let's unmute the lines there and see if anybody has a question on the phone that they haven't been able to get in on the chat box.
Yeah, please feel free to unmute yourselves if you have any questions.
I think the chat box functions actually work pretty well, so I want to thank those of you who have used that. I don't think we have any questions coming in on the phone. So I'm going to end, Kate, if you want to go to the last slide there. This just tells you a little bit about how to get in touch with us, with any of our partners. If you want to learn more about family medicine residency programs, whether at St. Francis or Bay Health or Christiana or any place else, we're going to talk about undergraduate education. We're going to talk about going to college, University of Delaware, Del State, wherever you want to go, and you don't know where to start. You can certainly start with us. Send us your questions. We'll get them to the right board member, and we'll help you out. Again, all of the board members are here to serve, and we would very much love your interaction and your questions. So again, I want to thank all the members of the panel, thank everyone who helped put this together, and thank all of you who participated today and your families. I know many of your families are on the line listening. So parents, if you have questions as well, please shoot us an email later on. We're happy to help you. So thank you again. And I want to wish everybody a wonderful afternoon. Stay safe out there, and we'll see you next time.